Good afternoon. Today we will present our project on SDG 3, Good Health and Well-Being, focusing on healthcare access in Sub-Saharan Africa and our solution, the pod. My name is Victoria, and I'm here with Dana, Lennan, Kelly, and John. SDG 3 focuses on improving global health by reducing disease, ensuring access to quality healthcare, and promoting universal health coverage. The goal is to create a world where everyone has the opportunity to live a healthy life, regardless of their circumstances. Unfortunately, in many underserved regions, this is a major challenge. So, this is the issue that we aim to address in our project. Our SCG problem demonstrates how, in many parts of Africa, access to healthcare is a huge challenge, especially for children. Millions of kids face preventable illnesses, high mortality rates, and disruptions to their education simply because they can't get the medical care they need. Every year, about 5 million children under the age of 5 die, and nearly half of these deaths happen in sub-Saharan Africa. The worst part is that many of these deaths are preventable with better healthcare access. Many students miss 30 to 40 days of school each year, which makes it harder for them to keep up with their education. Another big challenge is the shortage of doctors. In Africa, there's only around 3 doctors for every 10,000 people, showing how these factors highlight the urgent need for better healthcare solutions. Our target market is children in Uganda. The lack of access to healthcare significantly affects children who face frequent illness, exhaustion, and missed schooling due to their health problems.
We're now going to dive into our target customer and the customer segmentation, which is the primary foundation upon which we've based our solution. We chose to focus on the customer segment of children under 5 in Uganda for a number of reasons. First, these solutions are accessible by finding creative solutions to provide these rural areas with resources. It is also differentiable in how children have specific healthcare needs that differ from adults. Also, it is actionable, as solutions can be found that are readily implementable yet will still make a drastic difference. The impact that one can have by improving health and well-being for children under 5 years old is measurable through UN surveys, and it is also substantial in its impact due to the highest children under 5 mortality rates being in sub-Saharan Africa. Our target customer is Jabari, a 4-year-old male that lives in a rural village in Uganda. He lives around 3 miles from the village center with his parents, 3 siblings, and 5 close relatives. Similarly to the rest of his community, Jabari's family is low income and survives by living off of their farm. Currently, as a kindergarten student, he has to walk 3 miles to and from school every day with shoes that give him blisters. School is a place where he can find happiness, as he loves playing soccer with his friends as well. Jabari has a few needs that would need to be solved in order to propel him and others closer to the goals of SDG 3 by having good health and well-being. First, improving access to healthcare and resources would help Jabari to live a stronger and more fulfilled life. Second, if Jabari had access to a closer medical facility, he would be healthier and less plagued by ailments. Access to a mode of transportation, even just having better shoes, would make going places safer and less painful. Ultimately, all Jabari wants is to be his happiest and healthiest self so that he can grow his relationship with peers and provide support to his family.
Now that we've outlined our target customer and their needs, let's dive into the solution. In this section, we'll explore how our approach directly addresses these issues and the value it creates for those who need it most. Our solution is the pod, a compact mobile healthcare unit designed specifically for schools in rural Uganda. The pod is lightweight, weather-resistant, and secure, ensuring that essential medical supplies, hygiene products, and nutritional support reach the children who need them most. Unlike traditional healthcare models that require families to travel long distances to clinics, the pod brings healthcare directly to schools. This ensures that children like Jabari receive an immediate attention when they need it most. Each pod is operated by a dedicated nurse, creating a sustainable, community-driven solution that empowers schools to take an active role in the child's healthcare. The pod operates on a biweekly delivery model, ensuring a continuous supply of essential healthcare and nutrition resources. Key components include basic healthcare and first aid resources, hygiene essentials, and nutritional support. The pod creates a lasting impact by improving health outcomes, increasing school attendance, and strengthening overall community well-being. By addressing minor healthcare issues before they become a major problem, the pod reduces child mortality rates and prevents common illnesses, allowing children to stay in school and focus on learning. Additionally, families benefit from economic relief as they no longer have to make costly and time-consuming trips to distant medical facilities. By aligning with SDG 3, the pod provides a scalable, innovative solution that ensures children in rural Uganda receive the consistent healthcare and nutrition they need to grow, learn, and thrive creating a healthier future for the next generation.
So now we're going to talk about the revenue model that we've chosen and the pricing strategy factors that we've taken into account. So the revenue model that we've decided to go with is the donations and grants model. With this model, we will partner with nonprofits, organizations, the community, and the government to advocate for the funding needed to make the pod a success. The first pricing factor we took into account was all of the costs needed to make it happen. For the actual production of the structure, we plan to use durable materials and have it shipped overseas after it's fully manufactured. And while high-quality materials to make the pod could be costly, this would be considered a fixed cost as we would only need one pod for each school. All of the medical supplies in the pod would be bought wholesale in bulk to keep costs as low as possible and stored in neighboring warehouses that will be delivered to schools via trucking. And lastly, another cost of the pod would be the nurse salaries if we are not able to obtain volunteer nurses. And despite all these costs, we've chosen to go with the donations and grants model as our customer base are families like Jabari's who are low income and cannot afford simple healthcare as it is. This is why, despite our competitors, our solution is the best option for our target market, as they wouldn't be able to afford the other options regardless. And with the right amount of advertising advocating, we are confident we will be able to succeed with our model that would greatly benefit our target market, as it is free for our customers, accessible by being placed in schools, and aligned with our SDG for increased health and well-being for all with no fear of economic burden.
Now I'm going to dive into our communication strategy to promote our solution. Our campaign, The Pod, Health and Hope Within Reach, is dedicated to raising awareness about a critical issue, the lack of accessible healthcare for children like Dabari in underserved African communities. Far too many families face enormous challenges when seeking medical care for their children. Whether it's long travel distances, limited local facilities, or financial burdens that prevent them from getting help in time. Our mission is to inform and engage by sharing real stories, eye-opening facts, and offering practical solutions. We aim to inspire people to take action, whether that means advocating for change, encouraging healthcare investments, or simply helping us spread the word. We believe every child deserves a chance at a healthy future. Our tagline, The Pod, Health and Hope Within Reach, captures our vision of bringing healthcare directly to those who need it most. To connect with our audience on a deeper level, we focused on emotional storytelling. By sharing personal stories like Jabari's struggle with frequent illnesses and his family's inability to afford medical care, we can evoke empathy and a sense of urgency. We invite everyone to be part of the solution. Learn how the pod is transforming communities by offering trustworthy, reliable, and community-centered healthcare for children. And get involved. You can help by donating, advocating, or simply sharing this cause with others. Imagine a future where no child suffers because of distance or costs. Whether together we can make that happen. Now I'm going to walk through the customer journey and experience many families in underserved communities face when trying to access healthcare. Starting with problem recognition, for many families in underserved communities, accessing healthcare is a significant challenge. Barriers such as financial limitations, lack of transportation, and limited availability of services prevent children from receiving timely medical attention. Parents often notice symptoms of illness in their children but are hesitant to seek care due to their obstacles in the way. They are left feeling concerned. The next step is actions taken. As families search for solutions, they may hear about the pod through community discussions, local events, or school programs. They learn the pod offers accessible, affordable healthcare services for children, making it easier to get the care they need without the barriers they previously faced and leaving them more hopeful. Lastly, using the solution, when families visit the pod for the first time, they are welcomed into a supportive and professional healthcare environment. Children receive thorough checkups, accurate diagnosis, and appropriate treatment for their conditions. By the time they leave, families feel not only relieved but also empowered. Finally, post-use impact. After using the pod services, families begin to see meaningful long-term changes. With regular checkups and preventative care, children experience fewer health issues, leading to better school attendance and improved focus in the classroom. Parents feel more confident in managing their children's health, knowing they have a trusted resource they can turn to. Over time, the impact extends beyond individual families. The community as a whole becomes healthier, with improved education outcomes and reduced medical emergencies.
Our value delivery is evident by providing these kids with resources that are essential for their health that they didn't have before. We believe that it will make happier, healthier children. These children will be more energized and they will have brighter futures. Instead of focusing on their ailments, they'll be able to prioritize education, building friendships, and supporting their family. Thank you so much for listening to us today. We hope you adopt the pod.